said they've had a pimple. You know, so that's a warning sign. And again, if you take a close look, there's a little circle that we remove. We're going to remove it, check the margins, and chase the tentacles and make sure I get it all out, trying to leave the smallest possible defect. But unfortunately, this patient also had 4 layers of Mohs, and what you see in red here on the right is the actual size of the hole that was left after the cancer was removed. And I blocked it just to be nice to you guys. And here's the plastic surgery reconstruction that we did on the lip afterwards. And here she is 1 week afterwards. So it can look cosmetically very good after surgery. And the interesting thing about these 2 examples is that both patients are actually sitting right here. And unfortunately, Amanda, you have suffered, unfortunately she suffered from melanoma, and basal cells are not fun for her. So, you know, tell us your experience and why actually having more basal cells is more problematic for you.
Well, basal cells just seem, they pop up very often and frequent, and unfortunately, you know, with melanoma, I wanted it off. I didn't care about the scar. I was more worried about my health. With basal cells, it kind of appears like they're more of a nuisance, and they can really cause or feel like they're causing disfiguring. But luckily with Dr. Mejia, I mean, I don't even feel like I have scars. I've had 2 Mohs surgeries, 1 on my head, 1 on my ear, and I feel like I don't even have a scar. So I know that it probably will happen again, but luckily with him in my corner and you know, if we go into his office, I don't feel so worried as I was when I initially started.
And the interesting thing about it is with her tanning bed use, you saw the statistics, 40 to 100% of people with prior tanning bed use are going to develop non-melanoma basal cells and squamous cells. And unfortunately, she's got both of them. So if you don't think it's going to happen to you, it will. And unfortunately, that's what happened to Marucci also. And Marucci, you know, you never thought you would get skin cancers in Hispanic. Tell us what is that all about?
I went in to see Dr. Mejia because I had this annoying little whitehead right next to my nose. That's me back there. And I went to see him, and I thought he would just remove it and I'd walk away. About a week later, he called me and told me that after the biopsy, they found that I had basal cell carcinoma. And so I went in a week later and had the Mohs treatment, where I was shocked to find that this tiny little whitehead required so much surgery because, like he had described with the octopus, it had spread. So he did remove it, and thankfully he's also a plastic surgeon, so he was able to not just remove it, but also treat it to where you could not see a scar at all. So I was very relieved to have them behind me.
Thank you, Marucci and Amanda. Now the interesting thing about Marucci, which I'm a little bit concerned about because she runs an online apparel company called Running Ninja.
RunningNinja.net.
Yes, and you know, I'm actually concerned that she maybe have had some post-traumatic stress because this is not fun for people to go through. So why we advocate sun protection. So when I think of a running ninja, I think that perhaps now we have to go running at night and not during the sun. Is that perhaps what traumatized you?
It traumatized me a little, but now I wear sunscreen. And again, he was curious as to why I named it Running Ninja. And it's because runners will tell you that we come in all different shapes and sizes and ages. It's a sport that we can all do. But I did want to say one thing that he touched on. I do talk a lot about my skin cancer because what he said, I thought that I didn't have to wear sunscreen because I'm Hispanic. I thought that I was going to be able to get away with it. So I tell all of my African American friends and my Hispanic friends that we do need protection and we do need the sunscreen.
Thank you, Marucci. And kind of like the Running Ninja, if you got a mask and you think that perhaps you're going to be protected, well, get yourself that mask, start running, start protecting yourself because anyone can get non-melanoma skin cancers and melanoma. Thank you, Marucci. Thank you, Ben.